you doing, Ramo?
Good to see you, Mr. Luke.
So, Ramo, how long have you been in the mental health space for? And what roles have you played in your time?
Well, my background is I'm a nurse. I'm currently a clinical nurse consultant with the emergency service. So my role involves working with the ambulance or the police service, and I attend to all the crises in the community related to mental health. So my job is just to try to keep people out of the hospital and give them that support at the point of crisis. So it doesn't get any more acute than this. Been doing that for a couple of years now. Mental health, probably about 26 years now.
Yeah, true. And with those people who are going through those mental health crises and they've gotten to that pretty extreme stage, what would you say are some common factors that get people to that breaking point?
I think accumulation of life stresses, right? Everyone has, difficulties that they're going through with life. So a lot of these people have started off on the wrong path, started from a young age. Some of these people have, extensive trauma. Some of these people have current stresses and health conditions, every aspect of life. And accumulation of these factors over a long period of time, at some point, people have a breaking point.
Yeah, true.
Right? And it's the way I sort of look at it is it's like a slow quicksand. You can see the horizon in the beginning, but as you sink very, very slowly over a period of time, at some point in time, that quicksand's going to be just over your neck, and you won't be able to see. And that's sort of how life is with a lot of these people, and they're struggling.
Yeah. So, Ramo, when it comes to someone who's going through mental crisis, what's the difference between someone who's had depression or anxiety for a long time?
Well, you can use the term mental breakdown is the thing. So they're really in that really chaotic state. The term that we use in psychiatry is emotional dysregulated. So their emotion is just all over the place. So they could be extremely distressed. The person could also be extremely agitated. And this could be in combination with, drugs and alcohol with some of these clients. Basically, in the simplest form, they're not able to regulate or control their emotion. So they're in that highly distressed state, I should say. And I guess the problem is when a person is in that emotional state, they're at risk of getting into misadventure or at risk of harm to themselves. All right. So when you present to these type of clientele, their capacity to make those decisions, those judgment is quite impaired. So your main goal is to down-regulate them, as you say, and manage them and manage that crisis. And managing that crisis could be providing support at that time of need, or putting them in a safe space and allowing that crisis to sort of calm down and for them to sort of process things and then safety plan them.
Yeah, right.
Yeah. Because when people become dysregulated, they become at risk to themselves. A lot of the time, they become very quite impulsive, and you're not thinking on the rational mind at the time. It's more emotionally driven. So when a person's in distress, they do what they feel at the time in order to manage. And that's not a rational decision most of the time when you're in that state.
So you've worked in the mental health field for quite a while. Where did you come across TMS?
So I've worked in various areas of mental health in both the public, private setting, community setting, and I had the opportunity to work on one of the private hospitals here in Brisbane on a casual basis, probably for about, I'd say 16, 17 years. And I remember when TMS just first came out, I was curious about it, and it was offered as an additional treatment for people that are being admitted as a patient in a private hospital for treatment for their mental health condition. And I've seen over the years how people have actually self-reported, how it's actually helped them, and also seeing the changes what these people have gone through. So a person might come in, say, quite depressed, and they're going through their process of treatment with their medication and therapy, and somewhere along that line of them being in the hospital, the TMS has been offered to them as an additional treatment. And the patients are actually getting better, and they're reporting to say, I think TMS is helping me. And I've seen a lot of this trend over the years. And the question popped out at some point, maybe this would probably go into the Medicare because there's a therapeutic effect of this. So I was waiting, I guess, saying, this would be cool if the mainstream or the general public would be able to access this. So I was just hoping on the background that at some point this will come into Medicare. So I was just quietly watching it, and I wanted this to be accessible to the general population.
So before TMS was traditionally just only accessible through private hospitals and on a sort of crisis basis.
There, you're going to be admitted as a patient, and you're receiving psychiatric treatment as an inpatient treatment, not as an outpatient. And they're offering TMS while you're a patient as an additional treatment, in addition to all the things that you would get in a hospital, like, say, medication, counseling, and TMS is also an option that they offered at the time, but it wasn't available as an outpatient that it is now.
So TMS is obviously not a new type of treatment. And now with Medicare supporting TMS in Australia, how is this going to change the landscape of the mental health field when it comes to treating people with anxiety and depression?
Well, look, Medicare has funded this now for those people that meet the treatment resistant criteria for Medicare. There's a lot of factors in there, but in its simplest form, if a person has a history of taking 2 antidepressants in the past, meaning, they couldn't have taken an antidepressant, say, 10 years ago, and then another one 5 years ago, that means they've had 2, and have tried therapy at some point with minimal success, then they can qualify for the Medicaid criteria. And once they get approved, they got 35 sessions that Medicare will fund. So I think it's a game changer in the sense that this treatment here is now accessible to the general public. All right, and to meet that criteria, it's not very difficult at all. And I guess the most important thing is it's considered as an additional treatment when everything else has failed. And that is why Medicare made those criteria. So you wouldn't just go up front and say, oh, I think I'm depressed, let me have TMS. In order for you to qualify that criteria, Medicare specifically say history of taking 2 antidepressants, at least 2 antidepressants, because you got to make sure that you've tried other alternative first before you resort out to the TMS. So it's more of a, I guess, as an additional treatment when you think nothing else has worked for you.
And for those who have tried multiple different types of medication and they just find like there's nothing really sticking, nothing really working, what would you say to those who are considering trying to try TMS to find that state of mind that they're looking for?
Well, a lot of people are very frustrated right now. A lot of people are struggling with their mental health. I think a lot of them had a lot of negative experiences from taking multiple medications, and they feel it's not improving. There's also people who have tried traditional therapy as well, and it doesn't work for everyone. It's a bit of a hit and miss. And a lot of people are giving up, like to say, oh, well, look, nothing's worked for me. So I guess if you're in that cohort there where you feel that you've tried everything, but you're not quite getting to the finish line, give TMS a go. If you qualify the criteria, what have you got to lose? No one up to date has died from TMS. It's got very, very minimal side effect. Most people, I think only a small amount might even get a headache, which is a very small number. Everyone, and there's no minimal side effect, whereas if you take a medication, you don't know how that medication will sort of affect you, whether it's going to work, whether you're going to have side effect, and it takes weeks. TMS, you come in, you have your treatment for 20 minutes, you sit down there, you're awake for the whole thing. There's no anesthesia whatsoever. And then after the treatment, you can go about doing what you do in life. You can go to work, you can go and do the afternoon. So I guess the context is, if you come with an open mind to say, look, this is something that I'm just willing to go because I've tried everything else, the reality is, what have you got to lose?
And what would you say your experience with TMS would be like compared to taking medication? How long does it take to start kicking in and seeing results?
Well, firstly, with antidepressants and medication, all right, when you take these type of medication, it's not like Panadol. You get a headache, you take the Panadol, you get relief straight away. It takes quite a period of time to get the therapeutic level of those medication. That could take weeks. And also with this medication, the typical medication, you have to increase the dose gradually over a period of time while monitoring for any potential side effect. All right. So this will take weeks and weeks and weeks. With TMS, you get 35. In the 35 session, the recommended treatment modality or frequency is between 3 to 5 days a week. All right. The main process behind that is you're trying to rewire your brain. Okay. Neuroplasticity, they call it. If you look at a person who's suffered a lot of suffering from depression and anxiety and trauma, and you manage to look through their brain and scan it, you would see their brain like a Christmas tree in a sense that it's firing all over the place, with all these memories and experiences they've had over a long period of time. And the problem, we can't shut it down because it's a habit that we've sort of formulated for the last 20, 30 years of our life, okay? Now, in order to get the effect out of TMS, you need the frequency. You're allowing neuroplasticity. And when you're having those sessions of TMS, you want to have it as frequently as you can, because when that TMS treatment, the TMS is going through the whole process, it interrupts all those pathways. All right, and that doesn't happen overnight. You need that over a period of time. So I guess the typical what we found through the people that we've treated at our clinic, most people self-report some sort of an improvement, I'd say within an average 8 treatment up. Although we've seen clients as well that have reported, minimal improvement, but then when they hit their 30th treatment, they said, hey, I'm feeling better. Now, we measure that with a lot of different tools. So number one, 35 sessions is a lot. 3 to 5 days a week, you're coming in there, we get to know you. So we get to see you from the first time you come in, what your demeanor is like, what your, how you're presenting, and also the relationship building. It becomes a bit of a safe space for clients. So over a period of time, as you have the treatment, we generally just find out, how is it going for you? Is it helping? So clients will report, yes, it's helping me, in what way? And they'll tell us their symptoms. We also use mood questionnaires that we collect pre-treatment, treatment 10, treatment 20, and then treatment 35 when they complete their treatment. And if there's any signs of improvement or lack of improvement, those score variation changes. Okay, so, we've had clients that came in, they were scoring pretty high on those mood questionnaires. That just shows they're extremely stressed, depressed, and anxiety. When they go through treatment 10, those score values would be, say, half, or at least a reduction of 25%. And they're also reporting, I'm feeling a bit better. All right. Then we also have clients that just say, look, it's not working for me at all. Right. Nothing's 100%, but what we've found from the people that we've treated, I'd say at least 90% of these people has had some sort of positive response on TMS.
So for those who say, maybe this isn't quite working out for me, what would you say could be some common denominators there that are not giving them the best opportunity to get the best results from this beautiful treatment?
I think there's a lot of factors in there. I think the most important thing is consistency. All right, they need to have the consistency. And I think come with an open mind, okay? Because, if you're 25 years old, 30 years old, 40 years old, you've had 40, 30 years of conditioning the way things are, which treatment in existence that you're going to have 1 or 2 and expect a significant improvement. Yeah. Even if you took a medication today, you're not going to get better within a week. If you went and saw the best psychologist in the world, you're not going to have 2 sessions and then report, I feel amazing. It's just not going to work, right? So you've got to allow time for that to come through and come with an open mind, that to say that, look, I'll give this as an alternative option. So a lot of the clients, I think the consistency is an important thing, and what they're self-reporting or how they're going. So we monitor it all the way through, and I think the relationship building, the staff support, and TMS our clinic becoming a safe space for them, to come in and get that treatment is very, very important.
Now, TMS, does it just treat depression and anxiety, or does it treat any other mental conditions?
There's a lot of application for TMS at the moment, but with regards to lots of evidence base, the most evidence that it has in terms of treating things is mostly depression and anxiety. TMS has been around for over 15 years, I believe, here in Australia, treating the Department of Veteran Affairs soldiers for their PTSD and depression. So it's used to treat PTSD. TMS also can be used for treatment of OCD, although that's not covered under Medicare, obviously. It's also used in other fields, like TMS is being used for pain relief in some of the countries where you can actually put that TMS coil at that side of pain and treat it as well. What we're finding, a lot of the patients that are having TMS has comorbidity. So they have other conditions that are actually, in addition to being depressed. So it's very common to see a client that's got history of depression, they have anxiety. It's very common to see clients that's got anxiety and they got history of PTSD. Right? We have had clients as well that in addition to that, they've got OCD. All right. And OCD in itself as well is a set of behavior to manage anxiety. All right. So, part of our service is to educate these clients to say that, yes, you would have this comorbidity. You might not be aware of it, but you do have it. All right. So it treats a lot of other symptoms. I think schizophrenia is being treated for that as well. In other countries, there's also a protocol there for Parkinson's. Also for underactive bladder in women as well, it's got a treatment. So we're in the early stage of the technology innovation for TMS, and at the moment I think it's just more sort of known for treatment of depression and anxiety.
So if I were to get started with TMS today, what would be my first step?
You need a GP referral or a private psychiatrist referral. You need to go and get a referral from your GP or from your private psychiatrist. You need to download a copy of our referral form. You need to send it to our clinic. Once we receive that, one of our admin staff will contact you and arrange the next available appointment for that client to go and see our TMS psychiatrist. So the TMS psychiatrists are the one that approves the treatment, and they're the one that prescribes the protocol of what type of treatment you can have. The treatment itself is not very complicated. You either have left side or right side or a combination of both. And that really comes down to the signs and the symptoms the client is actually presenting or reports to the psychiatrist. As I said before, the criteria is not very hard to meet. So it's a matter of just making sure that you meet the main criteria, which is very straightforward. And once the psychiatrist has seen that patient, they can start TMS when they're ready.
So what's the difference between treating the left side or the right side of the brain?
So the most evidence side is the left side. Now, they say that the left side of the brain is a bit more underactive, and they say that when you stimulate it with a higher protocol of the magnetic pulses, in some ways it's like kick charging the brain in its simplest form. All right. So a lot of the neuro-veg symptoms that patient gets, which is the symptoms of low motivation, low energy, poor concentration. When you stimulate the left side of the brain, they find that it has an effect in some way of making those symptoms lessen or decreasing them. That's in simplest form. There's a lot more theory behind that. The right side of the brain, on the other hand, is a bit more hyperactive, I guess. A lot of ruminating thoughts, anxiety and things like that. So when you stimulate it with the right side protocol, which is a lower protocol, it has that effect of slowing down that part of the brain, which can help with anxiety. So we found treating them with the left side, if the person has more of depressive symptoms, can also relieve the anxiety side. If we find that they also have a lot of anxiety symptoms, it's not uncommon that the psychiatrist will say, let's treat you on both sides alternately. One day you might come in and have left side, one day you might come in and have the right side.
So you would have tried the TMS treatment before. How would you describe how it feels?
Well, it depends which side you get treated. I've had a lot of TMS, and I find it, actually it's I think in the beginning you don't know what to expect. But now I think the left side is, I would describe it like having a woodpecker. It basically, the way it works is every 4 seconds, 40 pulses of magnets being delivered. And then after that 4 seconds of that 40 pulses, you get a 10-second break. And that cycle repeats itself again, another 40 pulses delivered. So over the course of, say, 20 minutes, you get 3,000 pulses on the left side. The right side of the brain, it's more of a, how do I describe it? It doesn't have those chains, we call them. It's more of a continuous tapping, right? The way I describe it, it's more like a water drop. When the water's dropping, like a leaking tap, it's like that continuously over the course of, say, 18 to 19 minutes. There's about 1,200 pulses been delivered into that. And the way that works is, when you're getting those pulses delivered on the left side of the brain, that's 3,000 times that dose is traveling right across your pathways. So imagine, as I said before, your brain's like a Christmas tree. Your brain's incoherently all over each other. When you're traveling those 3,000 pulses, those other pathways gets weaker. In some way, it has the way of sort of organizing the brain. And when those pathways, those other pathways gets weaker and starts to work, a lot of patients tends to report and say that they feel lighter in their head. All right, which means a lot of those emotions, a lot of those things that are draining a lot of mental energy that's been firing incoherently for over the years, they get weaker. And then the brain liberates by getting more energy, and you're less preoccupied with thoughts and emotion. And what do? You feel lighter in the head. Well, that's my experience on TMS. What about you, Luke? You've had some TMS treatment as well, yeah?
Yeah, look, to be honest, when I was doing my research for just trying to find some mental health options that was going to be affordable and be accessible, TMS just randomly popped up on a Google search. And I will never forget how quickly you guys were to respond into the inquiry, how quick you were to be able to see me, to see a psychiatrist, to get booked in, to be able to start that treatment as soon as possible, providing that I did pass the eligibility. And I mean, you got me in the next day on a Saturday at 9 a.m., which is pretty wild. And by that Monday, we started treatment. And it's pretty cool. Like, hopped in, didn't really know what to expect. I did some research on YouTube, seeing there's people in America saying how they've had such bad anxiety where they couldn't leave the house, to the point where this was weeks and weeks before they could actually leave the house, get in a car and go get treatment themselves. But once getting that treatment, they almost felt like that quick initial alleviation off their shoulders, and they could start going out and venturing out into the world. So in my experience, when it comes to getting TMS, I found pretty much the similar result, where I could walk in, your brain felt pretty lazy and uninspired, to the point where you get that woodpecker on your brain and it's literally knocking out all the bad vibes in your head, and you're feeling a lot lighter, feeling energized, ready to go. And I started personally noticing results in the first 3 visits. And I think it's probably to a point where I didn't realize how depressed I was for such a long time, that finally getting that off my shoulders, I was just met with all this unmatched energy, which was a different beast to navigate with, because that was like the old me. And I had to now try and navigate who this new me is, and I had to try and define that myself, which was pretty cool.
Yeah, I do recall actually. You had some symptoms of tinnitus, didn't you? And you said it decreased a bit.
Yeah.
I think that's what you said. And I recall when you had your 10 treatment and you had the mood questionnaires, and I like to show patients, saying, look, when you first came in 10 treatments ago, which is probably say 2 weeks ago or so, this is what you were like, this is what is now. Is it better? Is it worse? And I think you looked at it and you halved it. I think you decreased the score.
It was more than half. It was like, from personal experience, I walked into that clinic this is sort of a Hail Mary. Like, I felt pretty hopeless, didn't know what to do, trying to look for that solution. And I was scoring 27 out of 30 on this patient questionnaire. And you look at those results and you go, geez, this is not great. Surely there's a way to do better. And in that 2 weeks when you gave the questionnaire to me, I didn't think much of it, just answered it, just how I felt in that moment. And I think it was like a 6 out of 30. And it was actually quite shocking to feel such a transformation in such a short time. I am very lucky though. With my job and my career, I can be very flexible of when I get this treatment. So I was going in 5 days a week. And I was very consistent, and I managed to do 5 sessions over the course, 5 sessions per week over the course of 7 weeks. And it was a totally different person from almost week 2.
Yeah. And, we hear that a lot. And, I think enthusiasm, is a good thing. And when we hear that a lot, we say, you know what, look, could be a placebo effect, but it's a good thing, right? And I say, just see how you go. And if you're feeling that, symptoms of improvement, let's see how you go for the remainder, 20, 25 session of your treatment. Hopefully it's going to keep going that way. And we hear that a lot, but towards the end of the treatment, as you go through, is it really a placebo effect now? That meaning you've had this amount of treatment, is it actually working? Because you'll get a bit more idea.
Yeah. And that's the thing, whether it's a placebo effect or not, I was feeling these feelings consistently over a period of time, and that was changing the way I was talking to myself, talking to other people, holding myself, to the point where you almost have to stay this person because you've now ingrained a new course of how you act and how you behave. And you'd see by doing things the old way, it just doesn't feel right or doesn't make sense.
I think the main thing that a lot of people self-report that we hear a lot is they feel lighter in their head, is the common quote that people say. And the other thing as well, a lot of the time people report there's that gap. Instead of a person getting into that certain heightened emotional state when they're at distress, which is a automatic set of behavior, when we find TMS is helping them, they start to become aware of their emotions. There's that sort of that gap where, let's say a person gets quite distressed, to go from 0 to 100 in a split of a second because what they felt at the time was quite stressful. And rather than them reacting very immediately towards that stressful situation, these people become very self-aware and they go, oh, I can see myself getting angry, I can see myself getting stressed. And then there's that gap where that gives them a bit of that awareness to say, how am I going to react to this? So they no longer feel trapped responding to that emotional conditioning that they've had for a long, long period of time. That's, very common as well.
Exactly. I noticed in particular, it was the end of my first week, and I noticed that my anxiety dial that was usually on 100 all the time was all the way to 0. And it was such a weird sense of being able to hear yourself and clearly listen to your thoughts and navigate through them, and react to certain situations based on that bit of time gap where you've actually had a chance to process how you're going to react to this. Because at the end of the day, we still have to react in one way or another, but it's just how much we want to react in the moment or react with a bit of knowledge in our up our sleeves so we can be the person who we want to be. React in those situations.
We've got a client that's sort of validate that. I think her measurement that she felt the TMS started to work was she's in the process of moving, had taken a day off work. She was in the process of, she arrived at the property to inspect it. And when she got there, the real estate agent just said, sorry, we've cancelled the appointment for today. You can't view the property. Now, this is a lady that, at time of distress, 0 to 100 and gets quite extremely emotional. And she said she recognized within herself at the time that she was starting to get angry and dysregulated, is the term. But then she was able to manage her behavior, and she just said to the girl, I think, okay, that's fine. And her partner commented and said, are you okay? Are you sure you're okay? And she said, I'm angry, but okay, I can't do much about it. So that was the first time she measured within herself to go, look, knowing me, I'll go 0 to 100 in that she said in the past, I'll go 0 to 100 in that thing, because it was a very, very frustrating moment. But she was able to regulate her emotion. So that was her measurement criteria, that she felt that TMS was helping her.
So when I was first looking at TMS, I did notice all the different treatment options out there. And I saw, based on the online forums, that it looked like ECT and TMS looked to be in the same boat. But after experiencing it and hearing other stories about ECT and TMS, they're just totally not. Like, what is the difference between ECT and TMS?
And that's right. I'm glad you brought that up, because there is a misconception of what TMS versus ECT is. All right. So basically, ECT stands for electroconvulsive therapy. In a nutshell, it's shock treatment. All right. It's been used for a very, very long time for a lot of people that are, extremely treatment resistant, or, very, very acute in the hospital. To have ECT, you got to go through the process of sedation. You have to have anesthesia. You need to go through recovery. And most of the time, that's hours and hours and hours, okay? What you're trying to do when you're having ECT is you're trying to promote seizure. That's what you're trying to do. In a way, it's like saying it's trying to reset the brain, as you say. And the way they measure the effectiveness of ECT is the stronger the seizure is, or the longer the seizure threshold is, or the duration, the more effective the treatment is. Now with TMS, the contraindication, which means you're not to have TMS if you have history of like epileptic seizure. All right, that's a definite no-no, because the worst outcome for someone having TMS is to actually have seizure. All right, and in saying that, I think in the research they've done, out of 30,000 treatment, there's been 5 incidents of seizure in one of the researchers come through. And that is just attributed to a lot of things, like say clinician error, wrong screening process. So it's very, very safe. So in a nutshell, you're trying to induce seizure with having ECT. With TMS, you don't want to have seizure, because that's the complication of having, when you have TMS, right? Which is, like I said, it's very, very low.
So obviously you'd have protocols in place to prevent that. How do you determine someone's like threshold with TMS?
So basically, the threshold, I guess, in a way, is like the prescription. It means that as you have the process of having TMS, it's what's the actual maximum dosage that you can have while you're having the TMS treatment. So when a person commences the TMS, they got to go through this process called TMS mapping. All right. So you're trying to locate that area of your brain, which is called the motor cortex. All right, and you're trying to measure the motor threshold. So that's just, in a nutshell, trying to find that point in that area of your brain where you're looking for that finger twitch. All right, and that's just a signal that as you undergo the TMS treatment, at some point you're going to get used to the stimulation. And every time the stimulation gets easier, you're going to feel like you're not really having much. So you will increase the dose, and you're getting to that point that you can't keep going up. There needs to be a safety parameter that we can't go over this value. So that's the purpose of the TMS mapping, which is the motor threshold, as we call it. And you got to be trained to be able to locate that. Obviously, a doctor can initiate that, a clinician can initiate that as well. And it's very individualized. So not everyone gets the same value. And this would be related to the person's, history, medication they're taking, dehydration level, head symmetry, all that stuff affects all the motor threshold.
Yeah. So if someone was to go get a session of ECT in a day, what could they do for the rest of the day versus someone who is going to get a session of TMS?
Well, look, with ECT, you're going to have to stay in hospital a couple of hours. You'll go in, you'll get screened, you'll have sedation, you'll be put to sleep, you'll have the the ECT treatment, and then you need to be recovered until you're fully awake. You need to be observed for about 4 hours at least until you're fully alert, and you're finding you need to be picked up by a relative and you can't drive, right? So that process is like at least half a day's gone. TMS, you come in, you sit down, you get, you put on the TMS head cap, or you get measured to find that area in your brain where they're going to put the magnetic coil in, which is in the left dorsal prefrontal cortex or right dorsal prefrontal cortex is the area of the brain, which is quite a complicated terminology. Anyway, so you're putting in that area, you sit down, you have the treatment, you're awake for the whole time, all right? And it finishes in 20 minutes. And after 20 minutes, get off the chair, go straight home. You don't have to stick around. So no medication, no sedation, nothing.
So you were saying before, ECT is like getting shock therapy, and TMS, it looks like shock therapy, but it's actually not. How would you describe TMS?
So TMS is you're using magnetic pulses. So when that magnetic coil is put in that area of your brain, it stimulates a series of magnetic pulses that travels to the neuron of your brain. Okay, and what you're trying to do there is, as I said, you're trying to promote neuroplasticity. You're sort of interrupting all those old emotional pathways that are being firing incoherently. And as I said, you're trying to fire up that area of your brain, the amygdala, and then in the right side of the brain, you're trying to slow down that conduction on that side to help with the anxiety symptoms as well. There's a lot more science behind that, but I could talk on for hours about that, so I won't. I'll keep it simple.
One thing I've got to ask, why get TMS with TMS Hub? I'm sure there's other TMS providers out there. What makes TMS Hub different to other TMS providers?
We're one of the very, very few clinics, I guess, in Queensland that really provides a bulk billing service. Okay, so when I say bulk billing, if the client meets the criteria for Medicare, they can access 35 session under Medicare with no out-of-gap fee. The only thing that they have to sort of pay is a one-off fee of, I think it's $220 just to cover the psychiatrist for the initial consult. But apart from that, there's no other costs. So our motivating factor is we know this treatment works. We've seen it work with a lot of people, and we want it to be accessible to the mainstream population. Hence, that's why we're not charging anything. We want to be affordable because we're the service that allows this treatment to be accessible by everyone. A lot of the clientele we've treated in the past, it would have just been impossible for these guys to even access an expensive service like this if it wasn't for us.
Now, is TMS Hub just offering just TMS services?
So TMS Hub is, we're going to be in coming months, we're probably going to be using TMS as an additional protocol for pain management. We're going to be incorporating that, probably in the next couple of months or so. We also found that a lot of the clients coming through here are actually needing ongoing psychology support as well because of their history. So we've been quite privileged to have a couple of other allied health jump in place, like a psychologist and also a mental health social worker to give that additional support for them in general.
So you've gone and had your TMS treatment. What is your best recommendations to follow up on a fresh treatment that you've just had?
When you say fresh treatment?
So I've just gone into the clinic and I've just had my 20 minutes under the machine, had my treatment. What would you suggest I do to maximize the results of such treatment?
Keep it consistent, all right? I'd say 3 to 5 times a week if you're able to. I know it's very difficult to do 5 days a week, but it's not a lifetime commitment, as I say to people. It's only for a short space of time. If you committed 5 days a week, in 7 weeks you have that complete, and it's only 20 minutes. If you can't do that, 3 days a week is better than 5 days, than nothing. Keep it consistent, and meanwhile, just trust the process and come in an open mind. If this doesn't work, what have you got to lose, right? Yeah. You're not going to be out of pocket by a lot of money, right? And nothing's worked. Okay, well, cool. You're not, then you try something else, and so it's an alternative treatment when everything else has failed.
So Ramo, when it comes to the clinic, one thing that I thoroughly enjoyed is the rapport that I have with the nurses. They've been absolutely incredible when it comes to making sure I'm keeping myself accountable, and not only that, actually feeling relaxed and enjoying the treatment process. How did you come across these staff?
So I've worked in a lot of the area of mental health right across here in Brisbane. So I had the privilege to work with a lot of these clinicians that's currently working at TMS Hub. Like I work with them clinically. They're very, very just caring, very empathic, very experienced. So when you're providing a TMS service, it's very important that you have very, very supportive and skilled staff. Because a lot of these patients that are having treatment at TMS Hub, life doesn't stop. They still have ongoing stress. So it's very important that these guys are given that support, and I guess support and nurtured as they go through the 35 session of TMS. Otherwise, if you're going to come in just for TMS treatment, you sit there, there's no engagement at all, I can guarantee you're not going to stick to the 35 session because, so it's part of that. It's the holistic thing. It's given the safe space, the reassurance, the support, developing that relationship, and with the staff and the patient is very, very important to make sure that they feel supported all the way through. So are patients getting better just from TMS itself? I think it's a combination of everything that we try to sort of offer, the staff support, the safe space, the less stress, and I think it's a combination of everything as well.
So, Ramo, I'd like to see how you could simply describe what is anxiety, what is depression, in like a visual way of explaining it.
Okay, or I'll make it very easy when trying to explain. I use this analogy when I'm trying to explain it to a patient. So I say, imagine you and me right here. You got a puddle of water in front of us, and I said to you, Luke, here's a bucket of water. There's a tap over there. I want you to go and get this bucket of water. Go into the tap, fill it up with water, and put it in this puddle of water in front of us. Now, imagine you did that. You did that every minute, every hour, every week, every month. At some point in time, this puddle of water is going to become bigger. At some point, it might even look like a pool, right? Now, let's say it became a pool after a period of time. And I said to you, well, it's become a pool. We need to empty it out and bring it back to the puddle it was, weeks, months, years ago. What's the most rational thing that you would do? You would say, well, I need to stop putting the water, right? I need to stop the tap, I need to stop putting the bucket of water into the puddle. The other solution would be to get a bucket of water, empty this out slowly. Okay, so the question is, did this puddle of water, this pool that you have now, did this happen overnight? No, it didn't. It happened over a long period of time. Okay. So the way I see it is that puddle of water that's turned into a pool, I say that represents like depression. All right, it doesn't happen overnight. It's things that builds up over a long period of time. You might not see it getting bigger slowly as you're putting the water, but then over a period of time it becomes bigger. The bucket of water that you're putting in there, these are your life stresses that you've encountered all the way through your journey in life, in the past, currently, or even in the future. So they're just filling in that actual pool of water. So the process is, if you want to address the depression, you have to stop putting in the tap of, the bucket of water in there. And at some point you need to empty it. So this is where all the holistic and synergistic type of treatment comes hand in hand. So I guess the way I look at it is, seeing a psychologist, for example, or therapy, is learning strategies on how to empty the bucket of water, and then at the same time stop the tap, right? So these are the tools that you learn through a good therapist, psychologist, and things like that. Medication in some way, I think is in a way of just saying, stopping the tap temporarily so it doesn't grow, all right? And the problem with a lot of people is they're trying to address the depression, but the tap of water is still running on the background. They're still filling it with a bucket of water, and on the other side, someone's trying to empty it, so they're not getting anywhere. Does that make sense?
Yeah. And how would you describe throwing TMS into the mix there? How does that change the situation?
If you look at traditional treatment, the most common treatment that people are going through at the moment is they're going medication and therapy. So when a person goes to their doctor and says, I'm not coping, I'm really stressed out, the primary outcome of that is the doctor will say, look, what's your symptoms? My symptoms is this, I can't think, I can't sleep, I'm feeling tired, etc., etc. The doctor will give you a medication, all right, to manage your symptoms. Okay. And at some point they might say, look, go and see a psychologist. So when you see a psychologist, there's a lot of things that these guys are very, very skilled at. And part of that would be, the talk therapy, the reassurance and the support, but also learning strategies and tools that you can manage your emotion. All right. So if you look at those modalities there, the medication is treating the symptoms. The actual therapy itself is managing the behavior and learning some tools to manage that. But a lot of those things are like preconditioned life experiences that's been habituated over a period of time. So TMS works or fits into that in the sense that it gets on the root, it interrupts those emotional pathways that triggers all those behavior, all those emotion that feeds all of that. So that's why, I think it's an additional complementary treatment in addition to everything else.
And so when it comes to someone who's on medication and trialing TMS, do they stay on their medication or do they reduce it? What's the situation like that for people who've been on medication for a long time?
We say to people, when you have the TMS treatment, stay at your baseline. If you're taking a medication, keep taking it, because we ideally do not want to be treating people while they're going through medication changes, because when you're going through medication changes or getting off the medication, your symptoms is going to be up and down. It could be good, it could be bad, right? And we want to isolate to say, we treat you at your baseline. When you're having TMS, is the TMS helping you, yes or no? And if you're not going through those changes, it's very easy for us to isolate. Is it helping you or not? If you're going through medication changes, taking off medication, it could hinder the treatment. You could be getting better, but we can't isolate it to say, is it actually from TMS or is it from medication? So we say to our clients, complete the 35 session of TMS. And when you have that 4 months break, after a 4 months break, you can access another 15 session under Medicare. So a total of 50 in your lifetime. Then that would be the time for you to explore within that 4 month gap whether the medication is actually, going off the medication or trialing new medication is ideal for you. All right. But not while you're going through the TMS treatment.